Hi, and welcome to the ARA Ortho Case of the Week. We're going to share with you a case that might be similar to yours or someone that you know. Tonight, we're going to shoot back about 16 years we met this patient. Let's see what we have. We have obviously some crowding. We have some crowding on the upper and the lower jaw. We have a peculiar bite. The lower teeth are outside of the uppers, on the sides, and the front. We call that anterior and posterior crossbite. The positions of the back teeth on both the upper and lower jaw are leaning in. You can see clearly here the lower teeth are completely leaning in, and so are the uppers are completely leaning in, reducing the perimeter, which is the space we have to accommodate for the teeth, further and creating more crowding in the process. Let's see why that is. Here we have also an upper jaw that I don't expect you guys to know this, but it has way too much growth on the back side. This is not what it's supposed to be. Also in the front, but a lot more in the back. That has two effects. Number one effect, it pushes the lower jaw. Normally the jaws meet like this, right? So they can be flat against each other when we're chewing. We'll see it more in an illustration in a second. But if you grow too much on the back side, it prevents the lower jaw from being able to close all the way, right? So it kicks back the lower jaw slightly. Sometimes the patient has to posture anteriorly in order to be able to chew slightly, like in this case with this patient. It also creates this tendency, because of the lower teeth now being ahead of the uppers, for the lower teeth to be pushed back by the pressure from the lip. Remember, the lips rest against the upper dentition that protects the lower. Immediately when that's not present here, the lower lip pushes against them. So it leans the lower teeth back, and as they do that, they cannot climb upwardly. You can clearly see that here, the biting surface of the jaw, which matches the rest of the jaw, it goes here, going downwards, until it gets to the front and starts climbing, right? That's because of what I just explained. As the teeth are pushed back, they curve up like a little bent cartwheel. Here's the line of occlusion, which is the bite. And then all of a sudden, ooh, I'm over here. This teeth should be over here. And we're going to do that in a few moments when we line them up. So anterior crossbite, posterior crossbite, malpositions, crowding. Let's see what we're going to do. We're going to remember this extra growth on the back, okay? In this case, we're going to need the help of an oral surgeon to correct these features. We're going to do the pre-surgical work, which we're going to see now. Then he comes in around the middle of the treatment or so, corrects the jaw position in bulk form, and then we tune in the teeth. Let's see what we did. Here I am. At this point in my career, I used to have the habit of taking some true lateral shots here of the overbite so I could see. So this is what I was describing earlier, where I said that it was an illusion that the teeth were kind of close to each other. That's not the case. It's just because they're bunched up right towards the back and higher up. I'm lining the teeth up. You can see how they're now called, they're divergent arches, right? So here we go. At this point, I still have some wisdom teeth, so I'm kind of battling that. Also, since the jaw is misplaced like this, the back side of the vertical dimension of the upper jaw is interfering with my position of the second molar. So not until I do the surgery, or they do the surgery, the surgeons, will I be able to really finish that bit out. Here I am. This is the pre-op at this point, getting ready to send them over. They're gonna take out the wisdom teeth, etc., and then perform the surgery. And this is what I have: divergent arches. He's gonna now take the upper jaw, remove some bone on the upper, move it upwardly, but more in the back, and reposition that lower jaw. I'm gonna show you an illustration. This is a video that will demonstrate that. This is a video we use here at the office by a company. So you can see here, they're gonna take out this wedge here. See how they're taking some in the front, but more in the back, right? So this is gonna move like this, like the hands of the clock, clockwise. And this one is gonna move counterclockwise, because remember how I said that the interference on the second molar? This is what I was talking about. So as this goes upwardly, my interference will disappear. I'll be able to line that up. But more importantly, the lower jaw is going to auto-correct, auto-rotate, like the hands of the clock, clockwise, bringing this incisor position more truly behind. So here we go. This is done inside of the jaw. No, there's no scars. You can see how they've moved that. Exactly. And then they put two titanium plates there. They fuse to the bone like an implant, nothing happens. But see what happens? The front automatically closes, the lower jaw rotates and sets in. And of course, now the profile is more balanced. Of course it is. Okay, so let's get away from that. This is immediately post-op, then at that point. More balance the patient immediately, right? And it's not perfect because these are both movements, the surgical movements, right? But our job is now to drive that in. But you can clearly see that immediately post-surgery, then there's no incisions, this is all done inside. The patient no longer has a crossbite. Again, this is how we sent them immediately before the procedure. And this is how he looks immediately after the procedure. Let's go here, before surgery, after surgery, and now we're going to be driving those teeth in with rubber bands and other means, arch wire bends, etc. We're going to drive the bite in, settling in more. We're starting to be able to now line up the second molar. It's not a coincidence, right? The interference is gone. And then here for our final photos, this is the day we take the braces off. I could take pictures the same day. The second molar is looking pretty good. The arch looking really good. Let's see what we used to have. This is before, of course. This is the after. It's a pretty good improvement. I think the patient would agree. And this is the before. He's leaning back and just collapse, right? And this is the after. And then let's see the smile. Before and after. Very satisfied with the result. This particular case, the surgical component was performed by a local surgeon, Dr. Alexander. Let's see what we have. So this is what we have. Let's see the pre-surgical setup. This was our face and bite before, and this is our face and bite after. This is our dental comparison, upper jaw, before and after, before and after. Anterior crossbite, posterior crossbite. This is all going to settle in. This is just, we literally just took the braces off. Just like when the teeth are growing and coming in, they kind of mesh together as the months go by. So that's our final result there for the day. What did we learn? We learned that some cases need the help of other practitioners, specialists like the oral surgeons. They just don't extract wisdom teeth only, right? Sometimes we do more complicated procedures with them. We learned that some problems are not only dental but skeletal in nature, and that we have to be mindful of those changes to plan ahead the case precisely so we can achieve a good result. It's been my pleasure sharing this with you today. If you have any questions, our bio and link for consultations is in our bottom of this video and also in our bio here on the channel. Feel free to give us a call. We'll be glad to help you out. Until next time, have a great night, and I'll see you in a few. Take care.